Matthew W. Johnsson, Professor of Psychiatry and Behavioral Sciences, Johns Hopkins University. Moderated by Funda Sezgi, co-CEO Norrsken Foundation.
Really, what a delight to have you here, Matthew. And I just want to start by saying that, like, I was sitting in the trenches of the academic world myself back in the day, doing research on impact ventures. And this was before Norrskens of the world really emerged, and there were barely any data points to really do the research on. Really nascent field, and I remember how much of a struggle it was to kind of find pieces to kind of write on. And then I was thinking about your research, and this must have been a bit of a work, at least in the early days, right? I mean, the whole taboo all around the world for decades to come. And now you're doing your research on it, so I just wanted to kind of acknowledge that. Well done.
As they say, it's been a long, strange trip.
Yeah.
Yeah.
Wonderful. I mean, if we can take a step back here, just wanted to understand, like, what is your view of the current state of mental health in the world and the existing treatments that we're seeing today?
Well, your introduction characterized it well. We need a lot of help. You know, we're at sort of all-time levels of suffering. There are treatments, and I do always want to make clear that for people struggling, that there are treatments. You know, the future use of psychedelics is very exciting, but treatments available now can help, but unfortunately, they fail to help a lot of people.
Who exactly?
And for some of the
like, I mean, what types of things are we not able to solve with the current?
If you name the mental disorder, and there's a substantial number of people who remain unhelped long-term, whether we're talking about depression, anxiety disorders such as PTSD, the various forms of addiction. Again, there are treatments that help, but for many of these disorders, for example, I've focused a very long time on addiction. And for many of the substance abuse disorders or addictions, the current treatments work better than nothing, but they fail to help the majority of people in the long term. For example, a year later. So there's a lot of room for improvement.
Got it. So even if we kind of find a way out of the situations that we find ourselves with, then we relapse back to the same situation more often than not.
Right, not always, but far too often, the suffering remains.
Super interesting. And like, before we dive deeper into the treatment effects of the substances that you're studying, it would be great to understand your, or hear your 5 minutes version of, I don't know, Psychedelics 101. Yeah. What are these substances? Like, what do they do, really?
Okay, Psychedelics 101. There won't be a quiz, so don't worry. But yeah, psychedelics is a broad term. The way I put it, these are psychoactive substances that have a relatively profound effect on one's view, perception of the world, and that can include one's perception of oneself. So they're more than just variations on a theme, you know, uppers, downers, as far as psychoactive drugs go. They can offer some relatively profound experiences for people. Okay. And they fall into different classes. The big one is what we call the classic psychedelics. This is LSD, the classics. Psilocybin, which is in so-called magic mushrooms. Mescaline, which is in peyote. DMT, which is in ayahuasca, the South American sacrament. Those are the prototypes. And they all share a common mechanism, activating a particular subtype of serotonin receptor in the brain. There are other drugs that are often called psychedelic. There's scientific debate of what should be called what, but my view is that it's a broad class. For example, MDMA, you might know it as Molly or ecstasy. MDMA is not a classic psychedelic, but it's related. It's a profound releaser of endogenous or naturally occurring serotonin in the brain, so a slightly different mechanism and substantially different effect, but profound overlaps. There's many others. There's ketamine, which affects rather than serotonin directly, the so-called NMDA brain receptor, and a long list of other ones. But those are some of the major classes of so-called psychedelics. And the thing that we have most explored as a science for the last 20 years, and this harkens back to the early research from the 1950s through the early 1970s, before this research was put on a deep freeze for decades, human research, I should say. So-called psychedelic therapy is about providing not a daily medication like with most mental health psychiatric medications, but providing a small number of experiences, many studies, 1, 2, or 3 experiences with one of these compounds, only after careful preparation, careful selection, because it's not appropriate for everybody. There are risks, to be clear. But after that process, having a monitored and supported experience. These experiences can provoke anxiety. That's one of the risks. But to have people, therapists that you've developed a rapport with, that you trust, that you can let go into psychotherapeutic process, explore yourself, and you feel comfortable with this person. But to have this experience, for psilocybin it would be about 6 hours long, where it's essentially a deep inner exploration. And we're still figuring out how it works, but there's often profoundly different views of oneself, insights into what one's suffering is about. We know that biologically there's a profound change in brain communication patterns that corresponds with this radically altered so-called state of consciousness. And then someone comes down, and rather than taking the pill the next day and the next and the next, like typical psychiatric medications, one discusses the experience in a number of follow-up sessions or so-called integration sessions with the therapist. And so far, what we're seeing with that limited number of sessions, 1, 2, or 3 sessions like this, we've seen for various addictions, for depression, for cancer-related distress, people with profound depression and anxiety because of a serious cancer diagnosis, this sort of existential distress. We see that profound reductions in suffering, whether it be continued substance use or continued depression, anxiety, not just the next day, but 6 months, a year. Some studies have even looked further than that later. And that's the really game-changing things, because that's weird for a psychiatric medication. Yeah. Because unlike typical medications, it's not about the drug at the surface level reducing suffering, such as anxiety symptoms, craving for a drug, this type of thing. It more goes to the deeper roots of these disorders. These questions that are more typically addressed with good psychotherapy and frankly just life. Yeah. People learning something about themselves, getting to the roots of their problems, taking a broader view of their suffering, putting things into context. The stuff that is for addictions often covered in 12-step programs. And it's often, depending on one's perspective, described as a spiritual experience, whether religious nominally or not, but one that really has that really at the broadest psychological level. What is meaning in life? What is your life about? And what direction do you want to take? So that's psychedelic therapy. And so far, it's looking really good. We have a lot to figure out, how to optimize, what this works for, what it doesn't, who it works best for, etc. But so far, it's looking really promising.
That's super, super interesting. And just to, there's so much to unpack in this, these 2 minutes of explanation. But are they found in the nature, or are we manufacturing these substances? Is this how you're separating between classical and not non-classical psychedelics?
Yeah, really both. Okay. So one of the biggest examples, much of the modern day psychedelic therapy research has been done with psilocybin, the magic mushroom drug. That does occur in nature in over 100 species of mushrooms, mostly in the psilocybe genus. But most of the research that's been conducted is with synthesized psilocybin, which is identical to what occurs in the mushroom, but that makes things a little easier to get it approved by the EMA or the FDA in the United States, where I'm from, and to have exact control over your dosage. But it's the same compound that's found in magic mushrooms, which grow abundantly in nature. And there's all variety of naturally occurring psychedelics. There's mescaline in the peyote and other cacti, like the San Pedro cactus. I mentioned ayahuasca, which is actually a combination of two different substances, one containing the psychedelic DMT and related compounds, and one that actually allows it to be orally active by altering the metabolism in the gut. And even LSD, famously discovered by Albert Hofmann, that's not known yet to occur in nature, but there are very close relatives. For example, in morning glory seeds that contains LSA, a very close cousin of LSD, which had a long indigenous use, for example, by the Aztecs in the Americas of sacramental use.
Super interesting. And what are then, you kind of touched upon this a little bit in how you describe the therapy or treatment setting, but what are the physiological effects of these substances on our body? How do you know how much to dose people?
Yeah.
How do you know that, we're not creating a situation out of the clinical trials that these people want to go back and want to do more of this? How does it work physiologically?
These are really different creatures. This is like which one of these, like Sesame Street, which one of these things doesn't belong is not like the others.
Yeah.
It's not like most drugs of abuse. And this, to be clear, these can be and are abused, used in an unwise, dangerous way. But there's certain unique characteristics. So for example, the classic psychedelics, even though they can be used unwisely or in a dangerous way, they're not addictive. They don't lend themselves to compulsive drug seeking. For example, people telling themselves with alcohol, tobacco, cocaine, opioids, etc., oh, I know I have a problem, I need to stop, but tomorrow, I'll keep using today. And then you tell yourself that tomorrow, and then next week, and then next year, and then decades later. This is addiction, compulsive drug seeking, this competition between what you want to do in the short and long term. Psychedelics, the classic psychedelics anyway, very clearly don't appear to be addictive. And that's consistent with the way they don't affect the brain's rewards centers the way that these other potentially addictive drugs do. And another characteristic that's favorable for them is that at the physiological bodily level, they're remarkably safe. Now, every drug has its risks, whether it's caffeine or over-the-counter headache medicines. It's a matter of what those risks are. The risks to the classic psychedelics are primarily in their psychological subjective effects, the intoxication, if you will. People can do dangerous things and sometimes are hurt, and rarely, but sometimes have a fatal accident, like with many intoxicating substances when used in a dangerous setting. But they don't, for most people, there's no physiological overdose. It doesn't make you stop breathing like opioids. It doesn't give you a cardiac event if you take too much, like many of the stimulants. It doesn't destroy your liver the way alcohol can. For people at very severe heart disease, it can be a risk. And these are people, if your doctor tells you, don't take the stairs, take the elevator, don't shovel snow, be careful doing these things, you're probably in the category, you'd be excluded from our studies, and there would be additional risk. But for people that are relatively healthy, there's no physiological overdose level. But there are risks. I mentioned having accidents, having the so-called bad trip, which is essentially can be a panic attack. An anxiety reaction, and the really dangerous part is if you're not psychologically supported through that and you're in a dangerous setting. And there can also be, I should mention, for a small percentage of the population who are actively dealing with disorders like schizophrenia or have an identifiable predisposition towards those, it does appear that there's a potential for these profound psychedelic experiences to destabilize those people. Fortunately, all of these major risk factors, severe heart disease, schizophrenia potential, we can screen for in a professional medical setting.
That's why it matters that this is done in a clinical setting, right? So you get the safe environment and then can make sure that any of the possible adverse effects are both pre-calculated and then controlled for if they happen. Got it. And like you explained a little bit how the clinical setting works, but I also wanted to just like tap into how are psychedelic assisted treatments different than regular psychological treatments?
Yeah. Well, there's two typical forms of treating mental health disorders. There's psychiatric medications, as I already said. The big difference with those is that you're not taking them every day. Clearly, there is a biological effect. We know that it has very real and frankly, radical effects in terms of brain function while one is on the substance. But you don't take it every day, thankfully, at least with the current, models of psychedelic therapy treatment. And most drugs, whether it's antidepressants or anti-anxiety medications like benzodiazepines or even addiction treatments like methadone or even nicotine replacement like a nicotine patch, those are all taken on a daily, regular basis. So that's a big difference. The other major form of mental health existing treatment is psychotherapy. And even though psychedelics are, by definition, a medication or a drug, they have far more in common, in fact, in terms of how they work with psychotherapy, because all of those things I described about learning something about yourself, taking your struggles and having a different perspective on them, finding a new path forward in life, establishing a new normal in terms of how you interact with other people, with the world, with yourself. All of that is the stuff of psychotherapy. And it's been described that this is like, when it works, it's like, so many hours, or sometimes people say years of psychotherapy packed into a single day. Now, it's impossible to validate that. I mean, it's not just the session day. There is preparation and integration. There's a process. But I think there's something, that analogy gets to something. It does appear that when it works, it's like good psychotherapy, or even just life experience that we all grow from. We could say, this is what I was like before. You fell in love for the first time or visited another culture for the first time, or these things that we grow from, whether it's psychotherapy or just life, it's more like that.
Yeah.
People have a narrative to tell. They learn something from it. So in that sense, it does have more in common in terms of how it works with psychotherapy.
Very interesting. And like in the then psychedelic assisted therapies, we have the clinical or medical professionals that are helping out as I guess to make sure that the setting is controlled and it's safe. Do they have any other function? Because it sounds like I, as a patient, I'm doing the learning journey myself, or am I guided by the facilitators?
It's really both, because I really think this is best unfolded in a context in which one can completely let go, to surrender to the experience, so to speak. And that's very hard to do when one is by themselves and they're taking care of themselves. And this is, for example, sometimes people, they take this at a concert, I'm not recommending it, and they have a panic reaction because they're not necessarily in a situation where they can let go into the experience and totally trust that they're being kept safe. So to have that caring relationship with the strong rapport with a trained mental health professional who has prepared them. And the real work happens, the real hard work is in establishing that relationship. And then on the session day, when they're actually taking the substance, they're there. That's an important role as well, but they're more there for the safety net. And to be clear, the way most of these treatments work, it's not talking throughout the entire experience. Most of the experience, a person is encouraged to let go and go into themselves.
Okay.
And the therapist is there to respond, to reassure them if, and it often comes up, not always, but if they have some anxiety, if they need some help, they could take their hand, remind them that they're being kept safe, and encourage them to move through it. But you're right, and one of the real core reasons why I think this is working so well is that when it works, it's because that patient feels that they have done the heavy lifting.
Yeah.
It's not just something superficial. And sometimes people mischaracterize it. Oh, it's an easy fix. Like, no. Sometimes at the end of these sessions, people say, that was the most exhausting, intense experience. And sometimes people say, my God, I don't understand how people take this for fun. Like, this is heavy work. You know, and you know, sometimes if someone's just looking to dance, sometimes that's all they get, and it is fun. But in this context, it is people, again, they do their own psychological exploration and heavy lifting, but that is facilitated by the trained professionals. And so there really is a role for psychotherapy here to optimize the outcomes.
Very interesting. And then if we then go back to research and what excites you to do more research on at this point, or about the findings that you have had that where you go like, oh wow, like this really can be the transformative thing for the entire global healthcare problem that we're facing.
Right. There's a lot to be done. We've just scratched the surface. So a few of the leading disorders and existing treatments, we need to get them to the finish line. We have to follow the data to be clear. So MDMA for PTSD, psilocybin for depression, psilocybin for some of the addictive disorders like tobacco or alcohol. We need those final so-called phase 3 trials, the final trials that by which the EMA, the FDA, et cetera, says, okay, yes, regular clinicians, not just in research, can use this under these specialized conditions that I've described. So we need that research, but that just scratches the surface. There's a lot of other disorders it's a good guess that this could work for because of this more general mechanism about learning something about yourself. That could potentially underlie, probably not all, but a whole variety of different disorders that haven't been explored before. We have to do the research to confirm that, to test that, so we need to do that. And then there's also the optimizing these therapies. How much preparation is necessary? How many sessions is optimal? You know, for people who are not helped, does a follow-up session a month later, 6 months later help? Especially when you're talking about really treatment-resistant disease, like the treatment-resistant depression. Maybe it will turn out that some people need a session every few months, for example. We need to let the data drive us on that. And dosage, optimizing the dosage, that's another one. And then there's hundreds of other compounds that are out there and ones still being discovered that we need to explore that are also part of the mix. So you name it, there are thousands of careers worth for the scientists or budding scientists out there. We've barely started yet.
Wow,
yeah.
Okay, so you did the heavy lifting at the beginning and now like the world can talk about it and it's almost like an invitation, I guess, to other scientists.
Right, and to be clear, there's still heavy lifting to be done. We're really just getting to the hard work now, I would say.
And if like this whole thing works and like we can really put see the results, positive results more and more, where like in 5-10 years do you see this field emerging towards?
Yeah, again, we need to let the data drive us, but here are my speculations. I think probably a number of these psychedelics are going to be approved for a number of disorders. I think a lot of people who haven't been helped yet are going to be helped. In that sense, I think it can transform mental health care. To be clear, not everything is going to work for everybody. And this isn't to throw out all the existing treatments. This is one other tool in the toolbox. But I do think a decent chunk of people that haven't been helped or that had been helped minimally can be helped, whether that's a few percent, whether that's half, we don't know. And there's just the fact that it's a very different treatment model is important for understanding and treating mental health care. I often say this is like, psychedelics therapy is a Trojan horse for introducing psychology back into psychiatry. Because whether it's a medication or not, it really is all of these things about understanding yourself and learning to interact with the world in a different way. That's often the heart of many of these disorders. So I think hopefully it's going to inform us about not only provide new treatments, but inform us about the very nature of not only mental health disorders, but optimal mental health.
Right, right.
And then even beyond treatments, I think perhaps the most exciting thing, these are just incredible probes for understanding the nature of the human mind. What's the connection between this hunk of meat in your skull and this experience you're having? And what you do in the world. I think these are incredible tools to understand, to start to learn what we can about the nature of mind.
Yeah, super interesting. What do we need to do to unlock this potential?
Well, we need the budding scientists and more the existing scientists to jump into the field, because there's more that, the few of us that were in this field 20 years ago, like, there's only so much you can do. Yeah. So we needed to keep growing. And pragmatically, funding, which is why it's exciting. More great organizations are joining and recognizing, oh no, this is being taken seriously. This is not about, reckless hedonism. This is about really taking this seriously and making important advances with a very cautious, sober mind. So we need more funding, both from governments, nonprofits. Yeah. There's a whole industry growing surrounding this as well. Yeah. And so we really need all of the above. We need to make sure people are, all the work is unfolding ethically and with the risks in mind. And but yeah, we need the funding in the field. It's been sorely lacking for many years. That's kind of the big thing.
Great. I mean, okay, then one last question to help us out here at Norrsken. Now that we have launched this initiative, I'm sure there's going to be a few people at least that will think that it's radical to use psychedelic substances on patients, right? So how do we answer? Matthew, help us out here.
I think that is true. These are radical treatments. But as you well put in your introduction, we have radical problems. Yeah. So it might take some radical solutions. That doesn't mean radically abandoning all caution, but it means not being afraid because of stigma, because of the most reckless use that you can draw plenty. You could show plenty of examples of that, but not to let that stigma keep us from using wisdom and the data, from carving out, some potential. You name the powerful tool, there's both positive potential and negative potential.
Exactly.
I can't think of any powerful tool that doesn't have both. True. And this is no different. We need to keep that in mind. So we can't, whether we like it or not, there has been use. It didn't go away in the 60s. But unfortunately, what we had been doing is ignoring all of the potential when it's used wisely and only allowing the, relatively speaking, more reckless use. So let's take a holistic view and to take a wise course and see if we can help some people and figure some things out.
This is so helpful. Mental notes taken. I know how to answer difficult questions. And thank you really for joining us here today, taking time from your important research and amplifying our message here, what we're trying to do with the Norrsken Mind initiative. So really appreciate it.
My pleasure.
And dear guests, if anyone would like to collaborate with us on this initiative or have any questions, comments, input, please find me or my colleague Emma Kristersen over there, the MD of Norrsken Mind Psychedelic Science Initiative. I don't know if you can see her, it's pretty dark, but maybe Emma, you can step up and take a step on the stage for a second while I'm finishing up. Please do find us, or you can go to our website, norrsken.org, norrskenmind.org, and yeah, really, thank you so much for listening and being with us today. Matthew.
Thank you.